Hey guys, welcome back. We're about to drop some more knowledge and continuing with the chronic diseases today. We're going to talk about cancer. Alright guys, so I'm sure everybody out there knows at least someone, if not a few people who have suffered with this horrible chronic disease. So let's get into it. I want you to be healthy. I want to prepare you. I want to equip you to be able to defend yourself against this if at all possible. So here it is guys, cancer. Let's get into it. Cancer is a term used to describe hundreds of diseases that share a common feature of uncontrolled abnormal growth and proliferation of cells. In some cases, it can spread to distant anatomical sites. The initial symptoms of cancer can be localized, as in a cough of a person with lung cancer, or systemic, as in drenching night sweats of Hodgkin's lymphoma. Following treatment, the symptoms of cancer can result from the progression of the illness and or from the side effects of the treatment itself. You got treatment options such as surgery, radiation, chemotherapy, and immunotherapy, either single or in a combination, and can be designed to achieve a cure or to control the disease and relieve symptoms. When cancer is cured, that is when it's considered to be in remission. This is thought to be permanent, but many cancers are considered cured if the patient does not have a recurrence within 5 years after treatment. Recurrence of cancer occurs when one or more cancer cells survive following treatment and subsequently proliferate over time. Virtually all individuals with cancer can benefit from rehabilitation and exercise. Did you hear that, guys? All. Isn't that nice? Alright. The goals of exercise therapy vary depending on whether an individual is receiving initial treatment for a new diagnosis or is in remission, or possibly is receiving treatment for reoccurrence. Moreover, the response to exercise and adaptability to training are influenced by whether the individual has local or metastatic disease, and by the side effect of the particular form of treatment. The specific role and application of exercise programming for individuals with cancer are required throughout understanding of a person's past and current medical history, treatments, medications, signs and symptoms, and functional capacity, as well as consideration of comorbidities. Exercise management for persons with cancer requires extensive individualization. Did you hear that, guys? Extensive. By the exercise professional. The key to recovery for people with cancer is to have hope. You have to be inspired. You have to have faith. You have to believe. And you also have to have the knowledge. And hopefully, guys, I'm giving you a little glimpse of that knowledge. Perhaps there is no greater example of hope for cancer survivors than Lance Armstrong. 5 victories in the Tour de France, which proved that it is indeed possible to have advanced cancer, undergo extensive treatment, and go on to achieve extraordinary levels of human performance. While most individuals with cancer will not exhibit the athletic prowess of Lance Armstrong, they will achieve a variety of health benefits from formal exercise programming and by adopting an active and fit way of living. That's a little snapshot right there, guys, of what it is. Now let's get into the effects on exercise response. Individuals with cancer, as well as cancer survivors, often have disease or treatment-specific physical limitations that pose challenges to exercise. Tumors can involve any part of the body, and their effects on the exercise response is directly related to the tissues affected. Pain is common with a tumor, involves musculoskeletal system. Shortness of breath is common with lung involvement. Neural defects and seizures are common when the central nervous system and brain are involved. And anemia is common when bone marrow is affected. Easy fatigability is common during treatment. In recovery, following treatment, and advanced cancer, the specific effects of cancer on the exercise response are determined by the tissues affected and by the extent of involvement. The result is often exercise intolerance, but the limiting factors can be varied. The side effects of anti-cancer therapy also affect the exercise response. Some side effects may occur early during treatment and then resolve once treatment ends, whereas other side effects may occur late during the treatment periods and may persist for some time thereafter or may be permanent. I'm going to put a table in here. Table 27.1. All right, here you go. Amputations result in permanent disability. Radiation and chemotherapy can be permanent. Scar formations in joints and lung and heart tissues. The drug-induced cardiomyopathies and anemia can cause a permanent limitation in cardiovascular function. So here's some effects on exercise training. Exercise training is safe and beneficial for cancer patients when the exercise is individualized to suit the characteristics of that person. For those undergoing therapy for cancer, exercise training should have the objectives of maintaining strength, endurance, and level of function. For cancer survivors who have completed treatment, exercise training should have the objective of returning them to their former level of physical and physiological function. Studies have shown that regular, moderate, intense aerobic exercise during cancer therapy results in reduced levels of fatigue, greater body satisfaction, maintenance of body weight, improved mood, less side effect severity, improved aerobic capacity, and a higher quality of life. Aerobic and resistance exercise programs have the potential to improve balance and bone remodeling and to reduce muscle weakness and the muscle wasting effects of glucocorticoids that are often part of the treatment regimen. Significant improvements in aerobic capacity, as measured by the 12-minute walk, have been observed in clients who participated in an aerobic exercise program, both home-based and supervised. In contrast, people who followed the motto of get more rest showed declines of as much as 25% in aerobic capacity during treatment. Individuals undergoing extensive cancer therapy benefits from low to moderate intense aerobic and resistance exercises. Despite the significant fatigue that cancer patients experience, exercise reduces fatigue and improves aerobic capacity, mood, and quality of life. The effects of exercise in individuals with cancer has been studied in patients receiving many different forms of therapy for different cancers. Now here's some results of exercise studies during the following cancer treatments have shown improvements in shoulder range of motion, flexibility, muscle strength, balance, treatment-related side effects, which we're talking about nausea, pain, and fatigue, aerobic capacity, weight control, body image, sense of control, depression and mood, and the quality of life. The effects of exercise on children receiving cancer treatment have not been extensively studied. However, survivors of childhood leukemia have observed to have mild, persistent cardiovascular compromise as a result of therapy. This does not usually impair function during exercise of moderate intensity, but may hinder elite-level athletic performance. Nonetheless, aerobic capacity and submaximal performance on both children and adults should significantly improve after a scientifically sound step-by-step exercise training program. A concern with adult cancer survivors is that they often have conditions such as coronary artery disease, hypertension, diabetes, and hyperlipidemia. Some cancer treatments also increase risk of cardiovascular disease and death from myocardial infarction. These comorbid conditions may actually influence exercise prescription and management more than the history of cancer itself. Cancer treatment usually includes some combination of surgery, radiation therapy, chemotherapy, immunotherapy. While many treatments have become more targeted to the type of tumor, most continue to cause significant side effects. Surgery can cause many side effects that clients need to learn to accommodate to within their exercise routine. In the acute stage, pain and loss of flexibility may be the primary side effects. Adequate pain control is critical for the client to be able to begin a basic flexibility and exercise program. Light exercise helps to hasten recovery. Long-term side effects of surgery can be related to pain from amputation and from motor and sensory nerve damage. Exercise programs may need to be adjusted for those physical changes and the client educated in how to move and maximize his or her abilities. Radiation is given in multiple doses, usually over several weeks. The effects of radiation therapy are cumulative over time. Fatigue gradually increases during the course of radiation therapy. Skin changes such as radiation dermatitis usually become evident towards the middle or end of the treatment. These side effects are generally mild to moderate and manageable with clinical intervention. Radiation dermatitis can be irritated with prescription, and the area may need to be covered with gauze or a bandage to keep it dry. More serious side effects are uncommonly seen. These include loss of flexibility in irradiated joints and cardiac or lung scarring, or both. Chemotherapy and immunotherapy are generally given in combination of drugs that have different mechanisms of action and side effect profiles. The severity of side effects depends on the dose of drug, the pharmacological profile, and to some extent the individual characteristic of the person. Most chemotherapy and immunotherapy drugs cause anemia, fatigue, and nausea, and many cause myopathies and neuropathies. Some medicines have dose-limiting toxicities that limit the amount of drug that can be given to prevent cardiomyopathy and pulmonary fibrosis. Corticosteroids are commonly given with chemotherapy to reduce some of the side effects or reduce tumor volume. Glucocorticosteroids contribute to muscle weakness, wasting, and changes in body composition that undoubtedly also influence balance and gait. The exercise prescription needs to take into account where an individual is in his or her treatment cycle, how well the side effects are being managed, and any physical changes that may put the person at risk during exercise. If chemotherapy is causing neuropathy, balance, safety issues need to be considered. Individuals on treatment are often limited by muscle weakness and pain from the tumor, the surgery, or the therapy itself. People are often in a debilitated state, and their ability to walk or perform other functional tests may be limited by the disease or the treatment and may necessitate alternative modes of testing and training. Exercise prescriptions should include slow progressions, flexibility surrounding medical management, and adaptability to change in the client's health status. Here's some exercise testing recommendations. It is appropriate for cancer survivors during the following treatment. Individuals actively receiving treatment are generally capable of completing exercise testing, and then the following of an exercise prescription calibrated to functional capacity and individual limitations that may be disease or treatment related. For clients who have completed therapy, regular exercise is important to maintain or improve function to prevent the development of diseases associated with inactivity, such as cardiovascular disease, become overweight, or diabetes. Former exercise testing should be individualized to the client with attention to the type and stage of cancer, type of treatment, and physical limitations. For example, persons actively receiving treatment who are anemic have reduced aerobic performance because of reduced oxygen carrying capacity. Exercise testing is useful to quantitatively monitor progress during training and the rehabilitation in order to help both the exercise specialist and the survivor track and see progress. Depending on the functional capacity of a client, exercise testing can usually be performed using standard protocols. Persons who are receiving treatment or who have recently completed treatment may be extremely deconditioned or may have experienced significant changes in body weight, either increases or decreases. And this may require low-level exercise protocols, submaximal, and subjective symptoms. Limited treadmill tests are well tolerated, even by debilitated clients, and provide information on aerobic capacity. Use the 12-lead electrocardiography may be indicated in some patients whose clinical profile places them at an increased risk of obstructive coronary artery disease. Got another table I'm going to insert here. Table 27.2. Okay, let's go over some of this. Special considerations for exercise testing include the following. Obtain basic history of diagnosis and treatment. Assess for adverse, acute, chronic, and late effects of cancer treatment. Evaluate other comorbidities that may influence ability and safety to exercise. Consider how cancer and its treatments may affect balance, agility, speed, flexibility, endurance, and strength, and select, modify, and interpret fitness tests accordingly. Determine if medical clearance is required prior to exercise testing. Consider relative and absolute contraindications to exercise testing. Recommendations for exercise programming are dependent on whether the individual is actively receiving cancer treatment, is a survivor, cured or in remission, or is being treated for recurrent or metastatic disease. I am going to insert 27.3 table. For people receiving treatment or with recurrent localized disease, the goal is to preserve and possibly even improve function. For survivors, the goal is to return to a healthy, active lifestyle and to make exercise an integral part of everyday life. For those with recurrent or metastatic disease, the goal needs to be tailored to the person's current level of function. In the setting of metastatic cancer, the goal may be to maintain mobility and independence in the home. Many persons have disease or treatment-specific limitations to exercise that necessitate accommodating the mode of exercise to the client's limitation. This would be needs of amputees, requirement for portable oxygen would be examples of that. The optimal frequency, duration, and time course of adaptation to aerobic and resistance exercise training in cancer patients are not known. There appears to be a dose-response relationship of exercise to fatigue, with less fatigue experienced in persons who exercise for duration for more than 10 minutes and in clients who exercise at least every other day. More studies of the dose response of exercise in cancer survivors is needed to further determine important prescribing guidelines. Longitudinal exercise studies in women with breast cancer survivors receiving peripheral stem cell transplant and survivors with malignant melanoma and colon cancer all demonstrate that persons adapt to exercise, become more physically fit, and experience less mood disturbance and an improved quality of life. The side effects of anti-cancer treatment can be acute or delayed in onset. Therefore, distinct issues must be addressed in exercise programming for persons who are actively receiving treatment versus survivors. During radiation therapy, for example, a client may experience radiation dermatitis, a reddening of the skin, that is painful and often limits motion. Radiation therapy can also cause an acute inflammatory response in lung tissue that can impair oxygen transfer. The effects of radiation have also a delayed onset, occurring months to years after therapy. For example, radiation can cause lung scarring many months after therapy. This will impair lung function. So in addition to chemotherapy and immunotherapy, have acute and long-term side effects that one needs to consider when planning exercise prescription. Virtually all anti-cancer drugs cause fatigue and declines in blood cell counts. Exercise prescriptions should take into account where a client is in treatment and accommodate for periods of increased fatigue and for cycles of treatment. Since most people are treated with combinations of surgery, radiation, chemotherapy, and immunotherapy, the exercise specialist is likely to encounter a combination of treatment-related problems. When survivors are actively receiving treatment, it is important to assess the general health status. Persons with uncontrolled vomiting, pain, and diarrhea should postpone the exercise session. Individuals with neurotropenic fever should postpone the exercise session until the source of infection is determined and appropriate therapy has been stated. Exercise prescription for clients with thrombocytopenia. This is a platelet count which would be less than 50,000/mm3s. Must consider the risk of bleeding, and appropriate steps should be taken to prevent falls and increase in blood and intracranial pressure. Exercises should probably be limited to low-intensity walking, stationary cycling, and flexibility exercises. Although no studies have occurred, the effects of exercise in cancer survivors with clinically manifested coronary artery disease, logic would suggest that these persons may have to lower their exercise intensity to accommodate a lower oxygen carrying capacity during periods of anemia. So this is where the hemoglobin levels are affected. Exercise programs may need to be adjusted for changes in the individual's conditions and treatment plan. The following are special considerations for exercise programming. Assess client's current medical condition, functional ability, and general health before each exercise session. Consider relative and absolute contraindications to exercise. Develop an exercise program to accommodate to changes from cancer and its treatment that may alter balance, agility, speed, flexibility, endurance, and strength. Know where a client is in the treatment schedule and adapt the exercise program to the person's ability at each session. Recognize when to refer clients back to their physician for evaluation of new and worsening symptoms. Know cancer-specific emergencies, such as sudden loss of limb function, fever, incompetent patients, superior vena cava syndrome, spinal cord compression. And then you should have a plan for handling an emergency in this situation. Assess risks for adverse late effects of treatment that could increase risks associated with exercise. One of the examples could be heart failure. Adjust program for the presence of central line. This is where the peripheral inserted central catheter or port. Modify exercise program based on current medical conditions if the client is actively receiving treatment or has completed treatment. Alright guys, so that was it right there. I'm going to give you some websites here, some information. So this is review and critique of the quality of exercise, recommendations for cancer patients and survivors, right? There's another one here, was the evidence-based clinical patient guideline for prostate cancer. Those were just some of the sources. Evidence-based treatment for cancer-related fatigue, GNCI monographs. Alright guys, so here's the websites. Breast Cancer Watch. You can find this at http://breastcancer.org. evidence-watch.com, and National Cancer Institute, which is at www.cancer.gov. Alright guys, so that finishes this one. As you can see, regardless of what chronic disease you are currently challenged with, that's no excuse. There are proper programs, frequencies, and variables that can optimize and give you a greater outcome in regards to your health and wellness. So with that, I'm going to end this video. I wish you well. If you liked it, you know what to do. Hit that like button, subscribe, comment, share, and I'll be back with another one.